Good morning. You're watching News for Hearing Impaired. I'm Preeti. With me is Sonu. First, the headlines. On the last day of the 21-day lockdown, Prime Minister Narendra Modi to address the nation at 10 a.m. today. Total number of COVID-19 cases so far is 9,352, while 324 people have died from the virus. 979 people have been discharged. Meghalaya reports first case of COVID-19. Tamil Nadu and Arunachal Pradesh extend lockdown till April 30th. Madhya Pradesh Chief Minister Shivraj Singh Chauhan also in favour of extension of lockdown. Supreme Court modifies its earlier order on free tests for COVID-19 by private labs, allows them to test at ICMR rates, poorer people to be tested free under Pradhan Mantri Jan Arogya Yojana. Battle of humanity against COVID-19 continues across the world. More than 19 lakh cases reported till date. 1.19 lakh people have succumbed to the virus. US records 1,509 coronavirus daily deaths. France extends lockdown for another month. Italy's daily new coronavirus cases decline. IMF grants debt relief to 25 poor countries. Nation remembers Dr. Bhimrao Ambedkar on his 129th birth anniversary today. President, Vice President and Prime Minister greet fellow citizens on the occasion. Dr. Ambedkar was the chief architect of the Indian Constitution and was India's first Minister for Law and Justice. Prime Minister Narendra Modi will address the nation at 10 a.m. today. The 21-day nationwide lockdown to curb the spread of coronavirus ends tomorrow. The announcement was made yesterday by the Prime Minister's office via a tweet. Last month, the Prime Minister had addressed the nation twice on 19th and 24th of March. There are a total of 9,352 positive cases, out of which 8,048 are active. There are 979 people who have been discharged after full recovery. The number of deaths is 324. 25 districts across 15 states, which had reported the cases earlier, have not detected any new case in the last 14 days. Meghalaya had its first coronavirus case yesterday when a doctor at Shillong's Bethany hospital was tested positive. In view of the development, State Chief Minister K. Sangma announced the imposition of strict curfew in Shillong for 48 hours. He also assured the citizens that the government is fully equipped to handle the situation and appealed to them to extend their full cooperation.
We have immediately imposed a complete curfew in the city of Shillong for the next 48 hours. Also, we request everybody to kindly cooperate and not to leave their homes for the next 48 hours. We have also sealed the institution that where the information has been found and the case has been found. And at the same time, in this institution, which is Bethany Hospital, all the people who have visited Bethany Hospital from the 22nd of March and after that, I would sincerely urge all the citizens to kindly inform us by calling at 108 number.
Meghalaya Chief Secretary M.S. Rao has clarified that the present case is the one with travel history and is not a case of community transmission as is rumoured.
It is a case of travel history, so in a way the reason is known. So, it's not a case of community transmission. So, to that extent, it is a positive.
Chief Minister K. Palaniswamy yesterday announced extension of lockdown in Tamil Nadu till April 30th. He said that the move was in accordance with the recommendations of medical and public health experts. Palaniswamy had earlier favoured prolonging the curbs till the end of this month in the meeting with Prime Minister Narendra Modi on Saturday. Several other state chief ministers too batted for extending the restrictions. The state cabinet gave the green signal for the lockdown to be extended till April 30th as per the CRPC and the Disaster Management Act 2005. The extended lockdown will continue with the same restrictions of essential commodities outlets and restaurants being allowed to open from the morning 6 a.m. till 1 p.m. in the afternoon. Additionally, bakeries have been allowed to open at the same timings, and also restaurants will be allowed to give takeaways. Ration card holders will get rice, dal, sugar, oil and other eligible items free of cost for the month of May. The families of unorganized workers, including construction laborers, will get cash support of Rs 1,000 each for the second time. Also, the guest laborers will get 15 kgs of rice, a kg of tur dal and a kg of edible oil free of cost. In Chennai, the state government has also made arrangements to help residents avail telemedicine services from doctors registered with the Telemedicine Society of India. Arunachal Pradesh also extended the lockdown till 30th of April with a few exceptions. The decision was taken in the state cabinet meeting chaired by Chief Minister Pema Khandu in Itanagar. The state has one confirmed COVID-19 case till now.
Lockdown will be continued in the state of Arunachal Pradesh till 30th of April 2020. So idea is that because this entire situation in the country as well as globally is becoming a very organic. So therefore we cannot take a very long duration decision at this stage. So the cabinet has taken a decision that this lockdown period in the state of Arunachal Pradesh will continue for another till 30th of April, and around that 30th of April we'll take a further decision how we are going to control the activities in the state.
Madhya Pradesh Chief Minister Shivraj Singh Chauhan has supported the extension of the lockdown. Let's listen in.
सभी मुख्यमंत्रियों ने माननीय प्रधानमंत्री जी से परसों निवेदन किया था जब उन्होंने वीडियो कॉन्फ्रेंसिंग के जरिए मुख्यमंत्रियों से संवाद किया था। सब एकजुट है, एक मत है कि ये लड़ाई प्रधानमंत्री श्रीमान नरेंद्र मोदी जी के नेतृत्व में लड़ी जा रही है। बहुत प्रभावी ढंग से सारा देश उनके पीछे है। हम मिलकर इस लड़ाई को लड़ें और सभी का सुझाव ये था कि लॉकडाउन 14 को समाप्त ना किया जाए, बढ़ाया जाए। ये आग्रह माननीय प्रधानमंत्री जी से हम लोगों ने किया है। कल माननीय प्रधानमंत्री जी जब देश को संबोधित करेंगे तो लॉकडाउन की पूरी रणनीति जनता के सामने रखेंगे।
In a step towards return of normalcy in the government establishments, several union ministers and senior officers returned to their offices on Monday, 2 days after a directive that all government officials who are entitled to official vehicles should return to work. A meeting was called by Union Information and Broadcasting Minister Prakash Javadekar, which was attended by Secretary and Joint Secretary. Speaking at the meeting, the minister said that media professionals are frontline warriors just like doctors and police personnel. He urged media personnel to fact-check information to maintain public interest. He also appealed to wear masks at work.
कोविड महामारी के खिलाफ देश लड़ रहा है और प्रधानमंत्री जी के नेतृत्व में उसमें हम विजयी होंगे। इसमें जैसे डॉक्टर, नर्सेस, सफाई कर्मचारी, पुलिस कर्मचारी, सरकारी कर्मचारी, बैंक के कर्मचारी, वैसे ही मीडिया के कर्मी जो है वो भी एक तरह से फ्रंट लाइन काम करते हैं, क्योंकि लोगों तक खबर पहुंचाना उनका काम है। उसके लिए जगह जगह जाते हैं। तो मेरा पहला आज यही रहेगा कि आप अपना ख्याल करिए।
Telecom Minister Ravi Shankar Prasad also resumed his work. He mentioned that Arogya Setu is an important app that can prove effective in protecting against coronavirus. He urged people to download the app on their mobile phones.
आरोग्य सेतु एक बहुत ही अच्छा प्लेटफॉर्म निकला है जिससे अपने आप मोबाइल फोन पर डाउनलोड करें और उसके माध्यम से आपके स्वास्थ्य की स्थिति, अगर सब कुछ ठीक है तो ग्रीन रहेगा, अगर किसी ऐसे व्यक्ति के संपर्क में आते हैं जो इससे अफेक्टेड है या अफेक्टेड होने वाला है तो वो येलो होगा या रेड होगा, और बाकी कई उसमें बहुत एक सुविधाएं उपलब्ध हैं जिससे आप अपने को सुरक्षित रखने की हर तकनीकी व्यवस्था का उपयोग कर सकते हैं.
Minister for Youth Affairs and Sports Kiran Rijiju also joined back office. All the guidelines regarding COVID-19 were followed and only senior officials and minimum required staff resumed operations in the office. Minority Affairs Minister Mukhtar Abbas Naqvi also took his first meeting after rejoining office. Joint Secretaries of Ministry of Minority Affairs attended the meeting. The minister reviewed various scholarships, skill development schemes and other development programs. The Supreme Court modified previous order with respect to providing free COVID test kits in private labs. In its modified order, the Apex Court said that the free testing for COVID-19 shall be available to persons eligible under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana as already implemented by the Government of India. Additionally, any other category of persons notified by the central government as economically weaker sections of the society can also avail free testing. The court said that the government may consider as to whether any other category of the weaker sections of the society, such as workers belonging to low-income groups in the informal sectors, beneficiaries of DBT, etc., are also eligible for the benefit of free testing. It has asked Union Government to issue appropriate guidelines in this regard within a week. The court allowed private labs to continue to charge the payment for testing of COVID-19 from persons who are able to make payment for testing fee as fixed by the ICMR. Emphasizing on homegrown produce, Union Minister Piyush Goyal praised DRDO's initiative of producing N99 masks. He said that taking inspiration from Prime Minister Narendra Modi, DRDO has been able to produce such efficient masks and these will prove to be beneficial in our fight against coronavirus. He also congratulated Defence Minister Rajnath Singh and DRDO scientists for their achievement.
प्रधानमंत्री श्री नरेंद्र मोदी जी के प्रेरणा से हमारे डीआरडीओ के इंजीनियर्स ने ये अति आधुनिक N99 मास्क बना के देश को समर्पित किया है. इस मास्क ने सभी टेस्ट पास कर दिए हैं, यह अप्रूव हो गया है हर साइंटिफिक लैबोरेटरी टेस्ट से और इसकी 12 महीने की अवधि है. ये 12 महीने तक आपके काम आ सकता है. मैं सभी डीआरडीओ के इंजीनियर्स को धन्यवाद भी दूंगा और आगे के लिए शुभकामनाएं.
Vishnu Agrawal, the first coronavirus victim from Indore, has now recovered completely. He was discharged from the hospital yesterday and on his return at home, he was given a grand welcome by the residents of Raj Ratna Apartments, Snehnagar, amid cheer and fervour displayed by his fellow residents. An air evacuation pod, that is AEP, was indigenously designed and fabricated by Naval Aircraft Yard Kochi under the Southern Naval Command SNC for safe air evacuation of COVID-19 patients from remote areas such as ships and islands in a fully sealed patient transfer capsule, eliminating the risk of cross-infection to pilots and evacuation team with no requirement of sanitation of aircraft post-evacuation. The evacuation pod, which was designed under guidance of Principal Medical Officer of the Naval Air Station at Kochi, INS Garud, in consultation with specialists from the Naval Hospital INHS Sanjeevani and headquarters of SNC, is made of aluminium, nitrile rubber and perspex. The highlight of the pod is that it weighs only 32 kgs and has incurred a manufacturing cost of 50,000 rupees, which is only 1% of the cost of an imported equivalent item. Trials of patients inside AEP were undertaken on board Advanced Light Helicopter and Dornier aircraft of the Indian Navy at SNC and successfully completed on 8th of this month. 12 AEPs are planned for distribution across Southern, Western, Eastern and Andaman and Nicobar naval commands. The successful induction of the AEP will vastly increase the Indian Navy's abilities in its relentless efforts towards aiding COVID prevention across the nation. India's northern neighbor Nepal has reported 2 new cases of coronavirus, taking the total number of infected persons in the country to 14. Ministry of Health and Population is conducting the contact tracing of the new confirmed cases. So far, 5,691 people have been tested for coronavirus in the Himalayan nation, with 519 tests conducted in the last 24 hours. With the latest 2 cases, Nepal has currently 13 active cases, while 1 person has recovered. Governors of 6 eastern U.S. states have begun drawing up plans for reopening after the coronavirus shutdown. Officials in New York, New Jersey, Rhode Island, Connecticut, Delaware and Pennsylvania promised an overwhelmingly prudent approach but gave no timeline. Nationwide, the U.S. has recorded over 5,55,000 virus cases and 22,000 deaths so far. The largest number of fatalities is still in and around New York City, with a death toll passing 10,000. According to a top U.S. health official, the outbreak could reach its peak in the United States this week as more signs of stabilization emerged. Meanwhile, President Trump is expected to name a council this week to advise on reopening the country. That will include his daughter Ivanka as a member. Spain let some businesses get back to work yesterday, but one of the strictest lockdowns in Europe remained in place despite slowing in the country's coronavirus death rate. Although some activities, including construction and manufacturing, were allowed to restart, Health Minister Salvador Illa said that Spain remained in lockdown. Shops, bars and public spaces are set to stay closed until at least April 26th. Confirmed coronavirus cases totaled 1,69,496, while the total death toll rose to 17,489. In Italy, deaths from COVID-19 rose by 566 yesterday, up from 431 the day before. But for a bit of relief, the number of new cases slowed to 3,153 from the previous day's 4,092. The number of new cases was the lowest since April 7th. The total death toll since the outbreak came to light on February 21 rose to 20,465. The number of officially confirmed cases climbed to 1,59,516, the third highest global tally behind those of United States and Spain. In France, lockdown has been extended until May 11 in order to curb coronavirus outbreak. President Macron said that progress has been made, but the battle has not yet won. Since March 17, people have been ordered to stay at home except to buy food and seek medical care. The lockdown was scheduled to end today. French president said that schools and shops would progressively reopen on May 11, but restaurants, hotels, cafes and cinemas would have to remain shut for long. He further said that international arrivals from non-European countries will remain prohibited until further notice. However, after a relentless increase until the first week of April, the number of patients in the ICU units has started to decline. France has registered nearly 15,000 COVID deaths and has over 98,076 confirmed cases so far. In another news coming in from coronavirus pandemic in Israel, the parliament speaker Benny Gantz has been given 48 hours to reach a deal on an emergency unity government with his former election rival, Prime Minister Benjamin Netanyahu. The negotiations were approved by President Rivlin minutes after Gantz's 4-week mandate to form a government expired. Although in a joint statement, Gantz's centrist Blue and White Alliance and Netanyahu's right-wing Likud party said that a significant progress has been made between the two in the wee hours. Speaking at the WHO briefing, Director General of WHO said that the health agency would publish strategic advice on dealing with the coronavirus pandemic as some countries consider lifting restrictions designed to stop the spread of the novel coronavirus. The decision comes as support to countries in making these decisions. The new strategic advice will summarize WHO's way forward and includes 6 criteria for countries as they consider lifting restrictions. Speaking in this regard, WHO's Executive Director, Health Emergencies Program, Michael Ryan, said that now is the time for vigilance and we need to be very, very careful. As countries consider lifting restrictions during lockdown, the General warned that we must replace lockdown with a very deeply educated, committed, empowered and engaged community. Spain let some businesses get back to work on Monday, but one of the strictest lockdowns in Europe remained in place despite slowing in the country's coronavirus death rate. To aid poor countries battling with deadly coronavirus, the grant from the International Monetary Fund comes as a relief. The International Monetary Fund on Monday announced that it approved an immediate debt relief of 25 poor countries to help them free up the funds to fight the pandemic. The countries benefiting are nearly all in Africa, but also include Afghanistan, Yemen and Haiti. In a statement, the IMF Managing Director, Kristalina Georgieva, said that this provides grant to the poorest and most vulnerable members to cover their IMF debt obligations for an initial phase over the next 6 months and will help them channel more of their scarce financial resources towards vital emergency medical and other relief efforts. On the eve of 129th birth anniversary of Dr. Bhim Sahib Ambedkar, the President of India, Shri Ramnath Kovind, greeted fellow citizens. In a message, the President said, and I quote him, "As a social reformer, educationist, jurist, economist, politician and legal expert, Dr. Ambedkar strived constantly for the benefit of the country and the society." He further said that Dr. Ambedkar envisaged such a society where social harmony and equality should prevail and dedicated his entire life for this purpose. Dr. Ambedkar has gifted India with such progressive and inclusive constitution, which has deepening and strengthening the belief of our fellow citizens in our democracy for the past several decades. He encouraged fellow citizens to take inspiration from Dr. Ambedkar's great stature, struggle and values and take a pledge to imbibe his teachings and ideals into our lives and contribute towards creating a strong and prosperous India. President urged all citizens to celebrate Ambedkar Jayanti while maintaining social distancing and staying at their home, keeping in mind the epidemic of COVID-19. All the citizens should celebrate Dr. Ambedkar Jayanti while maintaining social distancing and staying at home. And on this occasion, Prime Minister Narendra Modi took to Twitter to extend his greetings to the fellow citizens and also paid respect to the chief architect of the Indian Constitution. That's it in this edition of the news this hour. Thanks for watching. Namaskar.